Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the histology of the ductus deferens, also called vas deferens. So what is ductus deferens? The ductus deferens is a muscular tube that extends from the tail of the epididymis to the formation of ejaculatory duct in the prostate. So from the tail of the epididymis, and it is a content of the spermatic cord. It enters the abdomen through the inguinal canal, through the superficial inguinal ring, deep inguinal ring. Then it goes to the posterior part of the bladder, and it enters the prostate. It is dilated to form the prostatic, to form the ampoule of the vas deferens, and it unites with that of the duct of the seminal vesicle. Then there will be formation of ejaculatory duct here that open into the prostatic part of the urethra. So this is a long course. So it is a long tubular muscular structure that is beginning from the tail of the epididymis, ultimately going to the ejaculatory duct that opens into the prostatic part of the urethra. So if you go there, the the vas deferens structure. This is the histological structure of the vas deferens or ductus deferens. This is a cross section of the vas deferens, and we can assess the histological structure in the cross section of the vas deferens. So we'll get here the inner. It is composed of thick muscle layer. The muscle layer is very essential for the peristaltic propulsion of the semen during ejaculation. Okay, so this is the vas deferens here, and this is very much thick wall tubular muscular structure, and these muscles are smooth muscle. They are arranged in three layers. We have the outer longitudinal layer, inner longitudinal layer, in between we have the circular muscle layer. We have the lamina propria here, and the lumen is comparatively smaller. It is folded. The mucosa is longitudinally folded, and this is lined by pseudostratified ciliated columnar epithelium. The luminal cells of the pseudostratified ciliated columnar epithelium has sparse stereocilia that may be found. Here we'll get some stereocilia. Those are immotile cilia. They are branched. They increase the surface area and help in the propulsion of the content. Here, if we go to the structure, lining epithelium, pseudostratified ciliated columnar epithelium, then we have the lamina propria that is composed of collagen and elastic fiber. That is a loose connective tissue. Then we have the muscle. This muscle is the inner longitudinal muscle. Then circular muscle layer. Then we have the outer longitudinal muscle layer that is covered by the adventitia, that is another loose connective tissue that is rich in blood vessel, and that connective tissue is continuous with that of the other structures because the vas deferens is just a content of the spermatic cord. We have a lot of other structure like that of pampiniform plexus of vein is also present nearby. Okay, so this is vascular. The adventitia is vascular. This is fibroelastic connective tissue. So these are the pseudostratified columnar epithelium, and we have the basal cell and we have the columnar cell. Some of the cell has sparse stereocilia. These are non-motile, branched, long cilia. Okay, so what are the identifying point that is very important to us? We must know the identifying points. Okay, so The thick wall composed of smooth muscles. Smooth muscles are arranged in three layers, two longitudinal layer with an intervening circular muscle layer, relatively small lumen with longitudinal mucosal fold. Lumen is lined by pseudostratified columnar epithelium. Some of the luminal epithelium have sparse stereocilia. Lamina propria contains collagen and elastic fiber. The smooth muscle coat is surrounded by adventitia. That adventitia is a fibroelastic connective tissue that is rich in blood vessel. By means of adventitia, the, the adventitia is continuous with that of the other connective tissue inside the spermatic cord. Okay, so we have some Viva question. What are the identifying points for the slide? We just got it. What is the lining epithelium on the vas deferens? That is the pseudostratified columnar epithelium. How the epithelium of the vas deferens differs from that of the epididymis? Actually, vas deferens epithelial height is little less than that of the height of the epididymis pseudostratified columnar epithelial cells. So in vas deferens, the columnar cells are shorter comparatively to that of the epididymis. What type of muscles are present in the vas deferens? These are the smooth muscle and muscles making very thick wall for the peristaltic movement, for the propulsion of the content of the epididymis through the long vas deferens tube to the ejaculatory duct. How the muscles of this vas deferens are arranged? In the middle, we have circular muscle layer. On each side, we have the longitudinal muscle layer. What is the structure of lamina propria? That is loose connective tissue, rich in collagen and elastic fiber. And what is the structure of adventitia? That is the fibroelastic tissue, that is also connective tissue, that is also rich in blood vessel. Okay. What is the structure of the ampulla of the vas deferens? Ampulla is the terminal part of the vas deferens. The lumen will be dilated and folding will be branched out, look like a crypt, okay, or diverticular to the underlying tissue. Otherwise, the muscle arrangement is almost same. What is stereocilia? These are non-motile, long ciliary processes from the luminal surface of the cell. Okay, they are immotile, they are long, and their purpose to increase the surface area and to help in the transfer of the electrolyte from the cell to the lumen. What is the function of stereocilia? We just discussed that. What is vasectomy? This is the surgery. On both sides, it is done on the side of the scrotum to take a small piece of the ductus deferens so that sperm cannot come out of the epididymis. Sperm will remain in the epididymis and it will die out. And this is a male permanent sterilization surgery. It is practiced to have male sterilization program. What is ejaculatory duct? Ejaculatory duct is the union of the ampulla of the vas deferens and the seminal vesicle duct inside the substance of the prostate gland behind the posterior part of the urinary bladder. An ejaculatory duct passes through the prostate and it opens into the prostatic part of the urethra. Okay, so these are my references. And that's all about the histology of the vas deferens. If you have any question, please feel free to ask me. If you like any particular histology topic, please let me know. I will prepare for you. And please support my channel. Please subscribe me. Share the information with your friends and have a nice day. Bye now.